So I'm going to give you an example here. I'm going to create a scenario and make some assumptions. I'm assuming that there are 500 employees, and with that size, they're probably self-insured. I'm assuming that this company follows the national averages when it comes to what portion of the workforce is over 65. It starts with 7.4% in 2025 and grows to 2030 to almost 10%. I'm also assuming that roughly half of those people are going to have a spouse that's also in the group health plan. The second to last assumption is that I'm going to assume that starting in 2025, when properly informed and educated, that about 25% of those that are eligible will move over to Medicare. But that number will grow because remember, these people are still working there. And if they're still working at this company, they're now starting to tell their friends about, you know what, Medicare is a pretty good deal. And that percentage will grow over time. And then finally, I'm going to use national statistics in terms of what is the employer's cost when it comes to people that are over the age of 65. So with that being the assumptions, let's take a look at what that means. This year, 2025, there's the 500. At 7.4% of that population, that's 37 people over the age of 65. But half of them have spouses that are also over 65. So if you add those, we're now talking about 56 lives. Well, if 25% of those switch to Medicare, that's about 14. And if the employer cost per 65 plus life is $15,000, potentially you're talking about saving $212,000. Well, what happens in 2030? Remember, you've got this trend that's moving up from 7.4%, closing in on 10%. Well, now that same 500 employees, now there are 48 people that are over 65. Half of them have spouses that are over 65, so now we're talking about 72 people. If there are now 35% of the people making the switch because they've been hearing great things from their coworkers, and if $19,000 is the number with a 5% inflation trend, now you're talking about $500,000 that goes to your bottom line.